One of the things that I've faced my entire career is that kids who are experiencing the most severe forms of trauma, kids who have experienced human trafficking, domestic violence, firearm violence, there were very few places to send those kids. And for many years, I've thought, what if there was a place where you could get all your needs met, where you could have somebody who met you where you're at and say, what are your goals of care? How do you want to get better? How do we prevent future trauma from happening? Where no matter what trauma you're facing as a child or as a family, that you could get help for any and all of those forms of trauma in one place, at one visit. What if we created that space at Odessa?
The whole concept was for patients and families and youth in the community. Where are they not getting seen? What care are they not getting? And reaching out to community partners to interview them, and came up with this idea of Care Clinic.
First I came up with care, and I just kind of scrambled my brain until I came up with an acronym for care, and it worked out brilliantly as Community Advocacy Restorative Education Youth Center.
In thinking about the Care Clinic and how to describe it, one of the foundational pieces is it is a trauma-informed clinic. We have behavioral health, we have medical, we have care navigator, and we have all sorts of supports on hand and on deck ready, including nutrition, social work, care coordination, but really wanting to be a one-stop shop for patients, wanting them to be able to come in and get multiple needs met in one visit and in one clinic.
We are focusing on a relationship with someone called the Care Navigator. They are a person with lived experience who's going to help a young person and or their family navigate their way through these systems.
The first step in a trauma-informed system is to ensure safety. So before they walk in the door, we're going to know what your triggers are, what kinds of threats that we should know about ahead of time, and then subsequently plan for all of those things. My hope is that we work really hard to instill a sense of safety for them, to be able to come into our clinic feeling like I can get my care here and I don't have to worry.
This type of care, the care we're going to offer at Care Clinic, is not reimbursable. We are so lucky to work for an organization like Seattle Children's and like Odessa Brown, where we have the option to cover things that aren't compensated, that we have generous donors that allow us to think not what can we afford to do, but what should we do, and make sure that's what we focus on.
The platform that Odessa Brown Children's Clinic / Cares Clinic has given me is not only for my voice to be heard, but for the community to be heard.
I hope that patients will come to Care Clinic and feel relief. I want them to feel like the support that they've been searching for is what they find when they come to Care Clinic. This clinic doesn't just represent a building, it represents the collective vision that we have for our young people.